Quadcast Nation, welcome back. Was about to hit the gym, getting psyched for the oil. I hope this ages well, but it's game 6 and we got to come out in full effect, yo. But I had something that's been front of mind for a long time and wanted to put it into words. Okay. The theme here is urgency. Okay. So a lot of people ask me from a productivity perspective, how do you get to do all the things you do? And you know, there's some key principles there, like always looking at the most impactful thing. So always looking at the 80-20 rule. What can I do today that's going to allow me to achieve my goals with the biggest impact? There's the idea of delegating, so not getting involved in the weeds with everything you do and leaning on a team. The idea of avoiding distractions. For example, I don't get email notifications on my phone. Like, screw that. Like, social media notifications on my phone. Like, all these things add up, and I think it's important to be able to take away the noise. But one of the most valuable tools that has allowed me to be as productive as I am, and what I think we need right now, is a sense of urgency. A sense that if you do not move with this initiative or the needs of the public, there's going to be consequences. And when we look at healthcare as an example, we look at the pandemic, things that would normally take forever to get through, whether it's the vaccine science, whether it's other therapeutics, whether it's pivoting in terms of management. For example, we initially during the pandemic were intubating patients early. We thought this was the best thing for them. And clearly we were seeing that this was detrimental to patients. So we pivoted. We had that sense of urgency where we got to be able to do things differently to meet the needs of our public. We started putting patients on blood thinners without hardcore science to be able to back that up. But we saw the benefits, we saw the need, and we had that sense of urgency, and we delivered. And this is what we need now in general. I don't think there's enough of a sense of urgency within healthcare that people aren't like hustling. Like, I see so many low-lying fruit things right now. National licensure for healthcare professionals. Once again, you've heard me say this multiple times. I cannot help out in Manitoba if they need me. I would need about 6 to 8 weeks of paperwork to get that through. You tell me I don't have enough game for Manitobians, whatever you call people from Manitoba, Manitobans or Albertans, like, these barriers need to lift. When we look at the wait times, the surgical wait times, the lack of primary care, I'm not seeing innovation happening right now. And there are solutions out there. I'm going to give you a quick one out in Renfrew County. They, early in the pandemic, when they saw a lack of primary care, what they did was they tied a healthcare provider, a family doctor, to someone in the country, or someone in the province, sorry. So, for example, you might be in Renfrew County, but you have a virtual primary care doctor in Timmins. So if you got your appointment, you've had this rash you wanted to assess, they see you via video conference, they say, hey, we're going to order you some cortisone cream. You could go to your local pharmacy, or if you needed to get a test done or a biopsy done, you're going to do that in Renfrew, but the results are going to come into Timmins and they're going to help quarterback your care. Imagine if we could do that at scale. How many more people would have primary care physicians? I'll tell you, it might not solve the problem completely, but it would put a dent in it. Things like this that are at our disposal that we're not leaning into, it's crazy to me. We're about to hit a tsunami of healthcare needs. Someone told me the stats on the amount of healthcare needs that are coming as our population is going to be aging here soon. Like, our baby boomers are going to be using prime time use of healthcare resources. And do we have a solution? Do we have something that we're talking about? I don't hear much. And this is what created that urgency within us to create Prevention Over Prescription, to get that book out there, to help people that are struggling with their weight, with their mental health, with their sense of purpose. Like, here's a clear, easy read that puts you in the right direction, focuses on the one or two things that are going to put you in the right space, that can be an amplifier for not only yourself, but for your patients, your family, and so forth. So that book was written in a few months. Why? Because of that sense of urgency, the sense that we need this right now. And I want more of our clinicians to feel that. I want more of our researchers, our innovators, our administrators, our decision makers lean into that urgency now. And even, I gotta say, as a leader, like sometimes you might be in an industry that doesn't feel like there needs to be any urgency. Create it, illustrate it, paint the story where your next steps can impact lives or impact the company. Urgency is what we're lacking right now. And I don't know why we're lacking it. The time is now to hustle in so many levels. I'm focusing on healthcare, but even when you think about our economy and what's going on down south right now, the tariffs, urgency, folks. This is what we need. This is how I live my life, rightfully or wrongfully. My wife, who's a psychologist, is going to probably be like, yeah, this is your problem. But with all honesty, that productivity hack, getting the book out, getting podcast episodes out, getting that social media posts out, getting all these initiatives done within the department. Like there's a sense of urgency because if you don't have that, things lag. And I'm in an environment where it's lag central. Like I'm wearing my oil hat. I'm Alberta bred and born. The magic of being from there is that we do stuff. We get stuff done. And I want that to be contagious. Get her done. You know what I'm saying? See the problem, fix it, take away the barriers, have that sense of urgency, move. This is what we need, especially in healthcare, dog. All right, that's all I got to say. Check out Prevention Over Prescription. The book is killing it. Still a #1 bestseller. We're doing one-on-ones for those that are looking to get that extra boost in their healthcare journey. But this is what we're doing, folks, changing the boogie, because the boogie's got to change. Thanks so much.